until they were.
So do the sloths climb trees?
They had other rooms in the
Yeah.
house. They
Do you want a real sloth one day?
They moved out for college.
Yeah. It'll be fun, right?
Because they were just like.
Do you have any pets at home?
Yeah, like because they all.
What pets do you have? You have a cat? Oh, I love cats.
That place exists, so.
You're like, keep it hush hush, man. Don't bring it up.
Unless you're gonna pay for us to go there, like don't talk about it.
I feel the same way, man. I'm trying to throw you guys under the bus because plenty of people throw me under the bus.
Good.
Yeah. They're all about big numbers, big numbers. What's the speed of light? They always want to go faster than it. So, we've got a little mask for you. Did Mommy tell you about that? Yeah? Alright, so we're going to put that over your nose. You're going to take big sniffs out of it, okay? Then you're going to keep your lips together. Mommy, Daddy will come back with you. Or maybe one pair will come back with you.
One could be with her.
With her, yeah. She needs somebody, right? She looks exactly like you. So, do you want to head back? Which one? Who are we taking with us? Mommy or Daddy?
I want Mom.
Oh, you want Mommy. Of course you want Mommy. Okay.
Do you want one of your blankets? Which blanket do you want? Alright,
They all have their own blanket.
I want to. So this is that little nose mask. It smells really nice.
Why does it connect to that?
Well, because it's an elephant's nose, right? It's got a long trunk to it. So we can get a little bit of funny air through there. And all you have to do is breathe in and out, my dear, okay?
Is that what I thought this was supposed to make you silly. Are you being silly?
Hug. Right around your biceps, okay? Let me know if that's too tight, sweetheart, okay?
Do you want me to keep holding this?
I mean, you know, as long as it's sitting there, you don't have to. I imagine if you let go, it'll be fine at this point. Yeah.
You want to get out and play now?
You want to fly out of here, don't you? Okay, Mom, I'm going to give her a little...
Okay.
Just if you could make sure her... these legs... Get some of the nitrous off.
She did great, didn't she?
She's a trooper.
She didn't even move.
I think the whole family's a trooper. The fact that you guys drove in last night, that's... Why didn't you just come in yesterday? I guess you were working?
Yeah, I was working. Have fun. We'll see the fishies after. You can relax. It's sticky. Oh, it's okay. Just relax your head.
In my hair.
Uh-oh.
What is this?
It's tape. So you get medicine and...
Guess what? I'm going to put your finger in here. Like that.
All right.
How about that?
All right, Mom, so she's not going to have any memory from here forward.
All right.
Okay, kiss mommy goodbye. And mommy's gonna go to sleep now.
I think she's pretty...
Yeah, she's... Can you give me a chair? And you can take this out for now.
Here is the chair.
Oh, there's the chair.
Oh, okay. Here. So you got the tube in there?
slow. Alright, go. I got it, Mama. Come in. Look at this little angel.
You alright?
Yes.
Zarya.
Zarya did a good job too.
Take her down.
You would think that this guy's like millennial generation. He's always filming everything.
You wanna go and kiss your sister? Go and kiss your
At least
sister
it's
so
not
she can wake up. Go and hug her and kiss her. Kiss her so she can wake up.
You kisses?
Go and kiss your sister.
You can kiss her with your this one. You go, mwah. Wake up, sister.
She was so brave herself.
I thought it was closer to like 500. Yeah. I'm so used to kilometers, it's hard for me to like figure out miles, you know?
They don't make any sense, you know.
Say it again?
So they don't make any sense.
Doesn't make
Some
too much
random
sense to me,
number.
yeah. I'm starting, finally, 12 years into it,
Yeah, about a month ago, we found out that our daughter had 8 cavities, which was totally surprising for us because she has always been really healthy. We don't do a lot of sugar. We try to be very careful and conscientious. Admittedly, not the best flossers, but definitely brushing, drinking water, not juice, no soda, things like that. So it's actually kind of devastating to find out that her teeth were so bad. And we consulted with a few dentists in our area. I guess I should explain that we live in the San Francisco Bay Area. And so we were talking to some pediatric dentists after our general dentist found that she had 8 cavities and recommended we consult with a pediatric dentist to see what our options are. And I was pretty disappointed in the options that we had. I talked to some dentists, some pediatric dentists who, when I was asking them about materials, if we could do composite fillings, they were telling us that we could if we wanted to, but they actually just recommend using amalgam fillings still on kids, and I was very shocked. I asked some dentists if they have BPA and if their composite fillings have BPA, and they didn't know. They were just saying like, oh, I don't know, maybe not. I don't think some of them do. So it was pretty discouraging because I felt like our only options were to just have either a mouthful of metal or she'd have her teeth extracted.
Why did you reject amalgam?
The mercury, the metal, just the things that we've learned. I mean, I don't know a lot about it, but I know that mercury is not good for anybody, especially not a 5-year-old.
So even if they reassure you that mercury is not released, you still feel that it's still hazardous, right?
Right. It just didn't, there's enough information out there that it's not safe, that it's not, and especially if there are other alternatives. I feel like, especially now, there should be more alternatives, and there are, but they just haven't been promoted. Although I didn't know that until I found your practice and your website. It was very much an emotional roller coaster for us, especially for me, because first of all, I felt disappointed in myself that I let her teeth get so bad. I was not expecting that. And then I felt even more devastated that the only options I had for her were going to be metal in her mouth or mercury, nickel, whatever, all these things, and BPA that's going to impact her for a long time because she's only 5. And so it was pretty discouraging. So when I found your website, I saw that you were in Glendale, but that didn't matter to us. That we were, we have family in the area, and it's just a 5.5 hour drive. And so it was definitely worth it to find a practitioner who is, more in line with what we're looking for, understands being holistic with everything, not just teeth, but also just lifestyle. And just feeling like we were going to be valued and respected as patients, but also like in a safe place. Like I wanted someone who's going to intentionally choose the materials that were used, know why the things were done, not just kind of like, oh, because that's industry standard, or oh, that's because that's what insurance covers, but really to be intentional about what was chosen. And I felt like that was what I was looking for my child, and that's what I found here.
Actually, a few of her teeth were quite deep, and they had suggested doing pulpotomies on them and putting stainless steel crowns.
Correct.
So the way we do pulpotomies is a little different. We use more biocompatible materials. The cement that we use right over the nerve is a biocompatible cement called MTA.
Right.
And we generally just build up the tooth with a bonding technique that makes them pretty viable until they fall out. Our main purpose is to keep the teeth in the mouth for a few more years, really. And if they fall out, they may fall out a little earlier, they may fail, but at least they're closer to replacing their teeth anyway. I just don't like stainless steel crowns because they don't fit well, they irritate the gums, and most pulpotomies done the conventional way eventually fail, and they cause abscesses.
And that's another reason why we came here, is because I didn't know the extent. I mean, of course, like not being a dentist or a dental professional myself, and not really knowing how to read x-rays and just having limited x-rays, we didn't know the extent of the decay that she would have. And so if she was going to need a pulpotomy, which she ended up needing one, if she was going to need one, I wanted to be in a place where the materials that were used were safe, that the techniques were used were intentional, and that's why we came here. I was researching that I think the material that's typically used in many root canals is like 50% formaldehyde or something. Like I don't know the exact percentage, so don't quote me on that. But it's a very large percentage. I guess any percentage is too much formaldehyde in a living person, I think. But that was also like really devastating, thinking that was another option. So we were hoping for not as bad teeth, and I think that we were pleasantly surprised that some of them weren't as bad as we thought they were going to be. But I also knew that in case we were in case something happened where you went in to look at the teeth and the decay was more extensive than we thought it was going to be, I wanted to be in a place where, like I said, the materials, the technique, everything would be supportive of a more holistic perspective and just intentional about keeping her body healthy and safe, even when it comes to dentistry.
It's much easier when they're sedated, because then we can take our time and go slow in excavating all the deep decay, and then we usually switch to the laser. If there's any chance of avoiding a pulpotomy, then we will avoid it, and we will use the remaining decay that's close to the nerve with the laser, and that will avoid the tooth from dying. It will last longer, and of course any pulpotomy is an invasive procedure, so we try to avoid pulpotomies, but if we have to, then we do it the biocompatible way.
Which you were able to do
On three more
on three
teeth.
of them.
Yeah.
One of the consultations we had with a pediatric dentist who came actually recommended was 1 extraction, 5 pulpotomies with stainless steel caps, and 2 fillings. And I just felt like that was going to be a little bit aggressive, a lot more aggressive than what we wanted. And even if those were the things that we needed, like maybe she did need, I'm glad that she didn't, but even if she was in a situation where she needed all those pulpotomies, at least, I would want to be in a place where the option was not a stainless steel cap then. Trying to just have the least invasive procedure possible, and being with a dentist who was going to kind of hold that big picture of what health and wellness was going to be, while also trying to do the things that were going to be effective but least invasive, instead of just going straight for most aggressive and just pulling them out. And so yeah, that's why we're here.
Well, thanks for all your trust and for driving all the way. And it's very refreshing to see these beautiful kids and how healthy they are and how well disposed they were today. Even the 3-year-old had
Yeah.
a couple of fillings without even receiving a shot.
Right.
So she did amazing.
Yeah.
So thank you very much.
Thank you.